Well, welcome back to our viewers across the continent and around the globe. I'm Richard Nta. Well, history indicates that past pandemics have reshaped humankind in profound ways on social, health, and economic sectors globally. This year, with the COVID-19 pandemic, CGTN Africa brings you a series of features on some key individuals who made a difference in the battle against the pandemic. Here's Lindy Mtangana and Raman Yang with the first installment of CGTN Pandemic Warriors.
The year 2020 has been one of the most challenging in our lifetime. The coronavirus pandemic has kept the world in a near constant state of fear and vigilance and taken away lives and livelihoods. But amidst the suffering, the pain and the fear, we've also witnessed the endurance of the human spirit, resilience and selflessness. In the special series, CGTN Pandemic Warriors, we celebrate some of the amazing people on the African continent who exhibited heroism in the midst of a pandemic. I'm Lindy Mtongana.
And I'm Raman Yang. We certainly have some very interesting, inspirational stories lined up for you from pretty much all corners of the continent.
Now, Rama, what a year we've had. I mean, I'm sure you remember ringing in the new year back in December 2019 without a clue of what was to come in 2020.
Indeed, it certainly feels like an entire 5-year window has passed in the last 12 months, doesn't it? But the fact of the matter is, Lindy, like the rest of the human race, this continent has been waiting with bated breath for COVID-19 vaccines to bring back some semblance of normalcy, to return the smiles back to our faces instead of hiding them behind our masks. In the meantime, though, Lindy, we do have a lot of inspiration to come through from lots of people, from ordinary citizens to leaders at the very top.
Amazing stories from all corners of the continent. Let's get into our first pandemic warrior, a Ugandan engineer who is also a chef and has been running a rather unique ambulance business during this pandemic. Now, the ambulance has not been rushing people with medical emergencies to hospital, but rather supplying cooked meals to the hundreds of patients and health workers in hospitals. Damba Muhammad and his family prepare and distribute the food free of charge, and the food ambulance has the capacity to serve around 400 people in a day. CGTN's Michael Baleke brings us that story.
Responding to a health crisis, Damba Muhammad has been driving this ambulance at least once a week since Uganda announced its first case of COVID-19. But it's not your usual ambulance that handles medical emergencies. It's a food delivery van which Damba designed himself.
They told me that they are selling the ambulance. I said, let me buy it. I didn't buy it at the time of COVID, but I had the vehicle before. I brought it and I abandoned the vehicle there. When the epidemic started, it's when I started building the idea on it. What inspired me is when the president called to everybody to do what he can so that we can fight this epidemic. Because I had the idea of cooking and at the same time I can do the engineering, I sat down with my family and I set that food ambulance so that we can take food in hospital when they are still hot.
Damba is a ground engineer at Entebbe International Airport, but his love for cooking gave him ideas about the food ambulance.
Everybody is surprised when they hear that I'm an engineer at the same time I'm a chef. Engineer, all our family were engineers because our father was the chief engineer for the company in the 50s. So we all grew when we are engineers. Being a chef, when I went to UK, I worked in a food company for 7 years. So I was promoted up to a rank of chef tester. When I was still in India, the side of Pakistan, I used to cook. I learned how to do their cooking.
And Damba's cooking experience became more prominent as Uganda went into lockdown following the outbreak of COVID-19. Every once a week, Damba hits the market to buy assorted items from vegetables to meat, rice and fruits. At home, Damba, as the chef, is assisted by his spouses and children to prepare the food.
I felt so good when my husband brought forward this proposal. In this home, we love to cook, and we usually offer free food handouts to those in need. So I supported him because people are in a very bad situation. In Islam, when you give, God blesses you with more. Praise be to God.
When the cooking is done, the food is loaded into the ambulance's built-in flasks to keep it hot. It is then driven to designated COVID-19 treatment centers and healthcare facilities where it is distributed to frontline health workers and patients.
We are used to receiving ambulances, bringing in casualties, bringing in patients, but this time, actual ambulances carry patients, but this time around, the ambulance is bringing food. The food theater, it is an initiative, a new development in Uganda, an ambulance bringing food. It's great.
I'm loving the service because some of our workers here, at times they are financially not stable to access the food. So in case they get such an opportunity, it's really a good one. So I'm going to also take this opportunity to taste the food because just seeing it, it looks good.
We thank Haji Damba for the food he has given us. The food has come at a time when we most need it. We thank him so much because this has come from the bottom of his heart. He is a good man and may God reward him because some of us cannot afford such a meal.
Damba has been doing this for 10 months. This is Damba's food theater with a holding capacity of 400 meals. From meaty to vegetarian options, there is a variety of dishes to choose from.
The food is 100% free, 100% free. I had my saving. I said, okay, let me spare some.
Uganda continues to register a spike in COVID-19 cases and deaths. But Damba says this is a calling and pledges more support to the needy as long as he can afford it. Michael Baleke, CGTN, Kampala, Uganda.
Well, sometimes it really is just the small things, a little bit of compassion from a next-door neighbour or a gesture from a friend at work that can make the world of difference for both individuals and communities, Roma.
That certainly is the case, Lindy. And the fact of the matter is simple acts of everyday kindness have always set Africa as a whole apart. And now that's proving to be even more crucial than ever in the face of unprecedented adversity. Many leaders from across the continent were not left out in the fight against COVID-19. One stood out to be counted through a mix of effective policies covering everything from community mobilization, adherence to protective measures like washing our hands regularly and keeping our masks on, to better use of science and tech in minimizing the economic damage to citizens brought about by pandemic restriction measures. This is our outstanding leader's story. Take a look.
Rwanda, a country with a population of about 13 million people, has the lowest number of COVID-19 cases and fatalities. President Kagame has had a hands-on approach to the crisis, receiving and analyzing data daily, making his country the first in sub-Saharan Africa to take containment measures. On March 19th, the country recorded its first COVID-19 case. But even before this, in February, the country was already putting in place protective measures. In Kigali, testing labs were already operational.
We get them, I think it was on before 10th February, if I recall very well, beginning February. So far we can test these new coronaviruses. What remains to sustain that laboratory supply because it's new, they are rare on the market. So this is where we are now maneuvering here and there to compile the stock.
As one of the fastest growing economies on the continent, Rwanda has earned a reputation for innovation in many sectors, including healthcare, which has an excellent response system. Dr. Jose Nyamosore works at the Rwanda Biomedical Research Center in charge of the country's epidemic surveillance and response division. He says the experience Rwanda had combating Ebola helped them in readiness for COVID-19.
We keep adapting ourselves on the reality of the epidemics. And as I said, this comes after just where the Ebola is dropping. So we trained a lot of people. And the training does not only provide capacity, but it provides also the alertness to healthcare workers. So once you train someone on the highly pathogenic disease, it stays there, not only for that disease, but for any other disease.
To further strengthen its fight against COVID-19, the government of Rwanda introduced robots that help doctors collect data in the medical facilities from patients and use the same technology in airports to reduce contact and exposure to the virus.
Hello, I want to take your temperature. Okay.
If all together we join our efforts, we can fight anything that can happen.
While hopeful for a global solution to the end of the COVID-19 pandemic, we celebrate countries like Rwanda on the milestones they have made in containment of the virus.
It's hard to believe that one tiny virus has impacted nearly every person on the planet. In fact, Ramba, it's something we certainly never imagined would happen in our lifetime.
Indeed, it's one thing to read about massive public health emergencies like the Black Death back in the 1600s, a massive outbreak of the bubonic plague. And it's another thing entirely to actually live through a massive public health emergency of this nature, at this scale, and then have to completely rewrite your entire life and work balance in order to adapt to it.
Absolutely. I mean, living through it actually teaches you a lot about yourself. I mean, certainly for me, in the early days of this pandemic, I struggled to adjust to this new isolation that we were forced into. Travel restrictions, working from home, curfews. It was all quite unnerving for me at the start of all of this.
Indeed, I'm sure it was for billions of us really around the world. And you start seeing that showing up in the data that we came across on the business desk. So for instance, you've got parents who are used to a very specific routine, wake up in the morning, prep the kids for school, they're off to one location, you're off to another to actually get your work done. But now, because of this pandemic, you're all in one location and you somehow have to get your work done, but at the same time supervise the learning that your children are doing virtually online. For those of you who could actually afford to have that alternative to switch over to virtual learning.
And we were some of the lucky ones, isn't it? At the end of the day, we kept our jobs. Our livelihoods fundamentally did not change, and we were always safe and healthy.
In the span of roughly 6 months, the unemployment rate in this country basically tripled. There's a lot of damage, both on a social level, on an economic level, that this pandemic has done, and that might take years to fix.
And that damage is certainly very personal, Rama. I mean, these are stories that each and every one of us will carry, stories that we will tell about the lessons that were learned in this pandemic, and of course, lessons that will be handed down for generations to come. 10 months on, Nigerians share their experiences on lessons learned during the pandemic. For this and more from other countries, here's today's segment, Voices of the People.
In 2020, I wanted to have everything that I don't have, but now I have learned to appreciate what I have. I wanted to, in terms of enterprise, expand the business. I do events and photography and videography, but then those were the first things that were banned when the pandemic came in. I actually turned my house into a photo studio, so I had to use what I have.
We hope our government will prioritize the improvement of our healthcare system in 2021. We've had many epidemics. Our leaders should strengthen our health services by building hospitals that meet international standards and schools so that we can have a bright future.
We've proven to ourselves that actually we're quite resilient, without those things, without the luxuries of life. Probably taught us to be a lot more frugal in our spending, certainly given us more time with our families, to bond with our families and just not take for granted, time.
By any measure, 2020 has been a year of uncertainty and harsh economic realities. But many of us prevailed, some through sheer force of will, and others through the help of those who simply refused to give up entirely on humanity.
Well, yes, indeed, Rama. In fact, here in Kenya, millions of people found themselves at breaking point as the economic impact of pandemic restrictions took effect. But in the sprawling slum of Kibera, hope arrived in the form of Moses Omondi. His Adopt a Family campaign saved nearly 3,000 people from utter despair. Here's his story.
Home to an estimated 250,000 people,
Kibera is one of the largest urban slums in Africa. With overcrowding, poor infrastructure and limited access to essential services, it's just the kind of place many expected would suffer a massive wave of COVID-19 infections. But for the majority of people here, their biggest concern this year has been putting food on the table.
Remember, most places closed down, including hotels, construction sites, and these basic places where people will go and earn money per day, even going out to wash clothes. So this affected a bigger percentage of people here.
A long-time community organizer and Samaritan, Moses Omondi felt compelled to find a way to help those worst affected by the wave of job losses that accompanied COVID-19 restrictions.
And I thought, what can I do? So should I give them work? The directives could not allow. So can we give food? Yes, that one is a basic need. That no matter the epidemic, people will still need food. So I thought, why don't I look for a family that is capable, and we get food for those that are not able to get.
And thus, the Adopt a Family initiative was born, by simply connecting those who were struggling to make ends meet with givers from across Kenya and beyond. Moses was able to help thousands of people in Kibera with direct donations and food vouchers.
I first met Moses during this COVID pandemic. At the time, I was really struggling because my wife had cervical cancer and I could not afford to take her to hospital. Moses gave us vouchers for food and supporting my wife. Even though she died in August, I am thankful because they have kept on visiting and just checking on how we are progressing. Every month, they support us through the vouchers so that the kids can eat.
Adopt a Family also supports small businesses in Kibera.
I'm a teacher, and when COVID came, I'm teaching in a private school, and when COVID came, so we were told that the schools will not continue. I'm a mother of 4, so it was hectic. There's a group of teachers which Adopt a Family is supporting. He gave me 5,000.
During COVID-19, if we wouldn't have been careful, many children would have suffered from, they would have been malnourished. And number 2 is also, we've been able to give these families hope that you can have someone who doesn't know you to stand with you. Some of the families we supported, we didn't even know each other at all. And we ensured that the genuine families got the services that we were offering.
A man of the people, Moses' tireless efforts have certainly saved lives during this pandemic, while also spreading hope.
Lindy, that was a pretty compelling piece. What went through your mind? What are your impressions, your key takeaways when you went to do that piece in the field?
Well, I think the thing that struck me was that, we'd seen and heard a lot of conversation about how people had anticipated that spaces like Kibera would simply crumble under this new coronavirus pandemic, overcrowding, communities living in poverty. But what I found walking around with Moses was that, firstly, he's so well loved and so well known in the community. But what that really exemplified was how this community is strong together. That was my key takeaway from it all.
Well, the way we'd put it here, it's simply Ubuntu.
Yes, Ubuntu in action.
Exactly.
Absolutely.
And that really is one of the best things about this pandemic. It's brought out that spirit of selflessness among us. On this exclusive CGTN segment, here's a powerful voice from Chikwe Ehekweazu. He's the head of Nigeria's Center for Disease Control, brought to you by CGTN's Kelechi Emekalam.
Good to have you.
Thanks.
Now, how would you rate Africa's resilience during the pandemic?
Very early on, many leaders in Africa made some very hard decisions about shutting down their countries, literally. If you understand the economic reality of many countries in Africa, and we knew that we couldn't really afford the scale of the outbreak we're seeing in many countries in Western Europe at the time. We still got our fair share, and worked very hard then by also limiting travel within countries, across countries. Very painful decisions, economically very difficult for people.
How much efforts would you say are being put in place at the time to secure vaccines for Africa?
Some of the early ones that results have been announced provide unique challenges for our continent in terms of the requirements on refrigeration, the logistics involved, the very cold temperatures required to keep them. So, to be honest, we are looking forward to a few more announcements. There's a few that don't require that level of refrigeration. So what we are doing primarily is working with a collaboration called COVAX that's brought together CEPI, Gavi, two global health organizations with WHO, and through them we have our first entry point into the location, a number of vaccines. Hopefully will become available next year.
Well, how should Nigeria and in fact Africa, appreciate some of those who have done extraordinary works during this pandemic? Now, what for you has been the most outstanding?
Very often you hear about people that got infected because they didn't have the personal protective equipment that they needed, the gloves, the masks, the gowns, to provide the care. But they're confronted with a patient that is going down, and they know they have to do that work. So to me, these are really the heroes. They're often not in the limelight. They often work long hours unrecognized. And I think in a way, we've got to put them front and center of the discussion.
Of course, there was a somber mood and isolation that came with the pandemic, but some unexpected consequences too, especially because of the fact that human activity slowed down on an unprecedented scale.
Indeed, I don't think there's anything quite comparable in this particular instance. And nature gave us a very powerful statement as far as the human race is certainly concerned. So then, let's turn to our special segment on pandemic's gift to nature. We show you some of the unexpected effects on air. All right then, so air quality. One thing that this particular pandemic has done is that it's provided a massive natural experiment that essentially asks what happens if you take all 7 billion of us and you tell us, slow down, don't move around for a significant amount of time. The results, I think, speak for themselves. This is a combination of before and after pictures from different parts of the world, Lindy.
Absolutely amazing. I mean, as you said, what kind of, what would happen in this experiment when you remove humans? And this answer really speaks volumes. I mean, just have a look at these images.
Indeed, fascinating stuff. So let's start with India, right? So Mount Dalauda, this particular photo, the one at the bottom where you can actually see the mountain range, that was taken from about 160 kilometers away. And this gives you a very clear sense of just how bad the air pollution problem in India was.
I mean, in this top picture here, that mountain range looks like a plume of smoke possibly, or a cloud in the distance. So it's quite amazing that when you remove that pollution, you're actually able to see just the sheer beauty of the surroundings of this particular part of India.
Indeed, and of course this is a part of the Himalayas that we often just see when you're flying over it, not actually seeing it up close. Pretty much the same thing happening in India, in New Delhi. You look at these shots of Delhi, and the one at the top is what we normally think of, right? That's our stock shot of India. A lot of hazy air, a lot of air pollution, but then shut down the city for a bit. And look what happened.
I mean, it's almost like a screensaver kind of shot, right? This brilliant blue sky, birds flying. It's a beautiful shot of Delhi, and one that has only been achievable because of these lockdowns during this pandemic.
Indeed, and of course our last shot comes from Milan. Italy, of course, one of the hardest hit countries by COVID-19, especially in the early days. This is essentially one of the industrial heartland cities. Again, massive, massive difference. The air pollution that used to be there before the lockdown, completely gone.
Absolutely.
When everyone slows down.
And as you mentioned, one of the hardest hit countries in the beginning of this pandemic, of course, tourism was completely shut down, one of Italy's most important economic drivers. And even that alone, the lack of people, the lack of cars, had really changed the entire environment of this major city in Italy.
Indeed, and this really is a summary of just how big, how pervasive our footprint as a species tends to be on this particular planet. If this is not a strong wake-up call for all of us to do better, I really don't know what is, because we can and we must certainly do better.
Absolutely, Rama. In fact, to live through a pandemic is to see humanity and indeed the world we live in like we've never seen it before. And so, although we hold on to our memories of this time that we've experienced, future generations will rely on videos and images to understand what we lived through. So here's a look now at some other iconic images of this pandemic taken across Africa. And that brings us to the end of our first episode of CGTN Pandemic Warriors.
That certainly is the case. It's the end of the first episode, but not the end of the entire series. This, remember, is a fragile continent that many expected would cave in from the blows of a new virus, a novel virus whose ferociousness did strike fear in the heart of many. But this is Africa. It's home to people who've refused to take this latest challenge lying down, and it's led by leaders determined to see their people through.
Our inspiring story continues tomorrow in the next episode of the Pandemic Warriors, where we feature those that have made themselves the bedrock of support in the fight against the coronavirus pandemic, from those rushing the sick to hospital to those knocking on doors to help the overwhelmed, those who are struggling to cope with the new normal. That's all for today. We'll see you again tomorrow. Back to you in studio.
Well, I guess that'll do it, and that's it for this edition of Africa Live. Remember,